No, I'm not clairvoyant, but I guarantee of those of you who have clicked into this video, I already know that a large chunk of you have a white blob on your fingernail that has been bothering you for some time. You're probably sitting there at your desk, procrastinating work, staring at your fingernails going, why do I keep getting that? What is that? Is there something wrong with me? Am I dying on the inside? Well, before you panic, you're in the right video because we're going to be talking about that opaque white blob on your fingernail. It's called onycholysis. Onycholysis is caused by separation of the nail plate from the underlying nail bed. The white blob is not actually white coloration in your nail, but rather it is air under the nail plate. What you are seeing is basically the equivalent of if you have ever seen a car with that peel and stick window tint and it starts to bubble up. Those little bubbles appear white where the peel and stick window tint is peeling up off the underlying window. In this case, your nail plate is the window tint and your nail bed is the underlying window glass, and that white blob that you're seeing is an air bubble. This is in contrast to true white spots in the nails, aka leukonychia. As a side note, I have a whole video all about leukonychia, so after this rip-roaring good time, you're going to want to check that one out next because the panic train of nail findings should not end with onycholysis. I'm kidding. This is actually a super common nail disorder. In fact, if you go into Walmart, you go into your grocery store, you go shopping around, and you get real weird and go up to people and ask if you can look at their nails, I guarantee you the majority of people in there, you're going to find some onycholysis. It's just very common. It's not necessarily anything to catastrophize, although it can occur in a variety of more pressing settings, all of which we will detail today. So now that you have some understanding of what this actually is, it's not truly a white spot, but rather an air bubble. It most commonly is going to affect the nail at the tip, the distal end, right where the nail bed kind of ends, the free margin. That's usually where it's happening. It's not usually that air bubble up close to the little half moon lunula, aka the distal nail matrix. These white blobs are usually irregular in shape. They kind of have an abnormal border. They might be more to the lateral part of the nail tip. The nail surface itself is usually smooth, but if you have underlying conditions that are causing this, you might have nail pitting, you might have a rough nail, you might have some chalkiness on the nail plate. Onycholysis is not life-threatening. However, if left untreated, it does open you up for infections of the nail because you have sort of this exposed nail bed, so to speak, under that air bubble, and you are at greater risk for fingernail infections with nail fungus and with that pesky little bacteria that thrives in moist conditions and water, Pseudomonas. Pseudomonas causes the nail to turn green. As a side note, I have a video all about green nails caused by Pseudomonas, complication that you might encounter if you've been doing artificial nails for a long time. So check that, rager out if you want to know more about green nail syndrome. But green nail syndrome is a complication that might arise with long-standing untreated onycholysis. So why the heck do you have this? Why is the nail plate lifting up off the nail bed? Well, let me tell you, the buck does not stop here with a simple, well, this is why, because there are many possible reasons. One of the most common reasons for this is simply nail trauma, repeat trauma to the nail, causing parts of the nail plate to lift up. Manicures are going to be a culprit. This is one of the many reasons why I caution against aggressive cuticle manipulation, pushing back the cuticles, because that is definitely something that you might develop. And use of nail cosmetics or other chemicals around the nails that are irritating to the nail, such as acetone nail polish remover, nail polish itself, and all of the various nail adhesives, nail cosmetics, gel nail, manicures, etc. all can be really rough on the nail and cause parts of it to lift up from the underlying nail bed. Not just the nail cosmetics, but also things that you might encounter, such as chemicals that you might have to work with in your occupation. If you do a lot of what I describe as wet work, where you have frequent water immersions of your fingers, man, that can really take a toll on your hands, your fingernails, and it can really jack you up. And it's no wonder that the nail plate might be lifting up because it's just very irritating. So that's another situation we do see a lot more onycholysis, say in somebody who does a lot of dishwashing and sometimes they slack on wearing gloves, they wash dishes by hand. So that would be another situation. Then moving away from traumatic things, irritants, manicures, occupational hazards, then you also have underlying skin conditions that can affect the nail, and one finding you will often encounter would be onycholysis. The quintessential onycholytic nail disorder is going to be psoriasis, so much so that it has its own variation of onycholysis called the oil spot. They get a wide area of the nail plate lifting up from the underlying nail bed. It's called an oil spot because in contrast to the opaque white onycholytic nail of other etiologies, in this case it has more of a yellowish pink, so it looks like you've got grease stain on your fingernail. Then hand eczemas, such as dyshidrotic eczema or pompholyx, got a video on that, definitely can lead to onycholysis. Basically, it can affect one or multiple nails of the affected hand, and what you have here is a lot of inflammation around the nail folds, allowing for moisture to get up under the nail and, be a contributing factor here. And then there is lichen planus, a chronic inflammatory skin condition that definitely can really negatively impact one's nails. Check out my video about lichen planus. I do a deep dive there. It is a longer video, so get your popcorn if that rage bait sounds like a train you want to hop on. Then you have infections. Nail fungus can cause the nail plate to lift up, aka onycholysis. I've said this before, but fingernail fungus is not really common. It's more common to have toenail fungus. So if you've got onycholysis of the toenails, you might be inclined to consider a toenail fungus in that situation. But another infection that freaks people out, rightly so, it freaks me out and makes me itch because it's just not something you ever want to deal with, is called scabies. Scabies is a mite that burrows up under the skin, and it's called the 7-year itch for a reason, because your immune system is like, get this freaky deaky thing out of me. And even after it's treated and cleared up and goes away, the itch lasts for a long time. But scabies mites, they like to burrow in the web spaces between your fingers, and they like to get up under your fingernails and go to town up under there, and no wonder there's lifting of the nail plate. Don't panic, think you have scabies, but just covering all the bases here. Then you have underlying medical conditions that can mess up your nail and might lead to lifting up of the nail plate from the nail bed. A real doozy on the nails in general is going to be problems with your thyroid. Hyperthyroid or hypothyroid affects the nails in a variety of ways, onycholysis being one. Check out my video all about how thyroid disease impacts the nails. I go over all sorts of nail findings with thyroid disease specifically. Also, diabetes can impact the nails and lead to onycholysis, and not a disease, but rather just a state of being. Pregnancy definitely can cause onycholysis. Then you've got medications, and this is important because I feel as though a lot of people don't realize this can happen, and it definitely freaks them out. A variety of medications can cause what's known as a photoonycholysis, meaning you're taking the drug and then you go out in the sun. Ultraviolet radiation from the sun exposed to your nails causes basically like the same thing that we talk about with a photodermatitis, but this time it's specific to the nail, causes them to lift up. In contrast to maybe some of these other situations, it's definitely going to affect all exposed nails. What drugs do this? Tetracycline antibiotics like doxycycline, fluoroquinolone antibiotics, also certain oral retinoids like acitretin, aka Soriatane, and non-steroidal anti-inflammatory drugs that you might take for pain relief. Most commonly diclofenac. It's not going to affect your toenails if you wear closed-toed shoes, but if you go out with flip-flops flip-flops, sandals, no coverage of your toenails, yeah, you're going to get onycholysis there too. Also, medications known as psoralins, which are used as part of PUVA therapy. Then there are chemotherapeutics, specifically taxanes. Check out my video all about skin care during chemotherapy. I believe I mentioned that taxanes can be, well, quite taxing to your nails, and this is one of many nail issues. All right, so those are some of the broad categories of things that can cause this, but in the vast majority of you, it's likely going to be just trauma, wet work. If you have an underlying condition like psoriasis, for example, and you've got, like I described, that oil slick, you might also have nail pitting. That's another common nail psoriasis finding. Onycholysis can affect just one fingernail, it can affect multiple, it can affect all fingernails, it can just affect toenails, a couple of toenails, all toenails, or it can affect all fingers, all toes. You know, things going on internally like a thyroid disease or diabetes, you might be dealing with more widespread, you know, involving all 20 nails, but not necessarily. So just kind of keep that in the back of your lunchbox there for snack time. All right, now, like I said at the start of the video, the main thing that it needs to be distinguished from is leukonychia. Leukonychia is true whiteness in the nail. In contrast to onycholysis, leukonychia is not due to lifting up of the nail plate. It's not an air bubble, it's true whiteness, and the nail is still attached to the nail plate with leukonychia. So that's, you know, that's kind of a big one to DDX, if you will, which is shorthand for differential diagnosis. The white blob that you're seeing, you can look at it and stare it in the eye as long as you want. It's not going to reattach to the nail bed, okay? So just get that through your head. It's not going to go away overnight. There's nothing that's going to cure that overnight. It's not just going to spontaneously readhere. But don't get freaked out, because you can get that to go away with time, provided that whatever underlying issue caused it in the first place has been addressed. If you've got a toenail fungus infection and you just expect the onycholysis to auto-resolve, well, that's you know, you're thinking incorrectly. If you've got hypothyroidism, you got to get your thyroid checked out, treated, and then the nail can get back to where it needs to be. Keep in mind that you got to be patient here, because nails don't grow overnight. But once that trigger or inciting event or underlying issue is controlled, treated, the nail will grow out, and the new healthy nail that grows in will stick to the nail bed like it's supposed to. But you got to be patient. Fingernails grow roughly in 4 to 6 months. It takes for fingernails to grow out. Toenails significantly slower, anywhere from 8 months to a year to get your toenails to grow out. But with appropriate treatment of the underlying cause, they can recover. A new healthy nail will grow in and adhere down. Just got to be patient and stay consistent. The reason it's important for your nail to treat the underlying cause and tackle this or avoid the trigger, and I'll give you some general nail tips, okay? So don't click out of this video without that. You're like, oh gosh, here she goes again, just telling us to go to our doctor. No, I'm going to give you some practical at-home stuff to do too, okay? You in the back, rolling your eyes, getting ready. The reason treating the underlying cause is so important, so that the new healthy nail can grow in and adhere to the nail bed, is that if onycholysis goes unchecked and you're just continuing to have an onycholytic nail, that bubble is gonna open up the possibility wherein the underlying nail bed cornifies and turns into, and for all intents and purposes, the same kind of skin as what you have like on your finger. And at that point, then no new nail is going to adhere to that. You see, the nail bed is much different in the way that it is made, structured, compared to the skin on the rest of your finger. It's made in such a way so that the nail plate will adhere to that. But if that bubble is open for too long, unchecked, yeah, that nail bed can cornify, and you get what's called a disappearing nail bed. For example, that's something that some patients who have like lichen planus or psoriasis of the nails, that's something that they might experience, because those conditions are really hard to control in the nails. So they do deal with a lot of long-standing onycholysis. The first thing you want to do is trim that nail short and keep it trimmed short. This is going to do a couple of things. It's going to minimize trauma, and it's going to kind of help to prevent that spread, if you will, of the onycholysis. onycholysis. The other thing that you want to do is be really proactive with minimizing unnecessary trauma to the nail. Like, don't keep your, like I said, don't keep your fingernails long and use your nails to do a lot of things like peeling off labels. Get someone else to do that, okay? Push that off on someone else. Don't bite your nails, and if you struggle with nail biting, you're going to want to check out my video on how to stop nail biting, because I give a comprehensive overview of a complete behavioral reorientation to stop biting your nails. Nail biting is, you know, something I didn't mention, but not going to help with the onycholysis, that's for sure. And you're going to be putting your fingers in your mouth where you got all kinds of bacteria and stuff. You're going to get a nail infection. You're going to get a nail infection. Then you want to also, in addition to avoiding trauma, you're going to want to wear protective gloves, especially if you're doing a lot of wet work. Wear gloves. Don't back down on the glove wearing thing, because it really makes a difference, not only for controlling and, you know, preventing it from recurring so the new healthy nail can grow out appropriately, but also, like I said, you kind of have a little vulnerable territory there where if you're doing a lot of water work with no gloves on, that Pseudomonas can creep up on in there and you can get green nail syndrome. If you do have green nail syndrome, again, check out my video on that, but you're going to want to be doing those dilute vinegar soaks that I talk about in that video. So if you've already got a green nail, you need to watch the video. Some patients, you know, it kind of gets a little uncomfortable, and they do well with not only trimming the nails short, but actually taking some tape and taping the nail down. That provides some relief throughout the day. And then you also want to take measures to avoid unnecessary exposure to irritants. Bail on manicures, bail on nail polish remover. I mean, just leave your nails alone. No clipping the cuticles, no trimming, none of that. Nails are more than just a cosmetic adornment. They are really important for a lot of our manual activities, dexterity, precision. God forbid if you ever are in a situation where you lose your nails, you will really come to appreciate how valuable they are. They're not just there for ASMR tapping on bottles. Good news though, in the vast majority of cases, you can recover from this, and it's all about addressing the underlying cause. So that's what I wanted to say with regards to onycholysis. But take a little break, get yourself a beverage, get yourself some popcorn, call in sick to work, because you're definitely not going to want to miss my video all about leukonychia. And then when you go back to work, you can just throw around words like leukonychia, onycholysis, and people will be like, oh my God, this person is so smart that they're not going to want to burden you with unnecessary tasks at work, because they're just going to be like beholden to you, and they're going to go above and beyond to make your life as easy as possible. So watch that video next. But if you guys like this one, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.